Family may know best. Your next patient is a 74-year-old woman. The patient's daughter arranged the appointment because she has seen memory lapses in her mother. This type of presentation is becoming more and more common. Has it happened in your practice yet? Watch for it. And know this: an outside historian, someone other than your patient, is often a better reporter about cognitive change than the individual themselves. If your office gets a call from a worried loved one, see the patient and listen to the concerns. A study done in 1999 compared individuals with family members and evaluated their ability to identify significant change in cognitive abilities. Turns out family members were more accurate in identifying patients who eventually went on to be diagnosed with dementia. Using our standard algorithm for moving through the differential diagnosis when the complaint is memory loss, let's focus today on the AD8. That's the best tool available to collect information from an outside historian. The AD8 is designed to be completed by a family member or friend. The testing sensitivity and specificity is greatest when it's used in this way. As you ask someone to complete the form, point out two important factors they will want to consider as they answer each item. First, they're trying to identify if there has been a change in the particular area mentioned in the item. The time frame they should consider is in the last several years. They apply both of those criteria to each item. Notice in item number 2, the emotional aspect of that question. Remember what we talked about as a possible early sign of impending dementia, that emotional symptoms may appear. For the next 3 items, again, using the same criteria, we're looking to see if there's been a change in the last several years. Notice that these 3 questions have to do more specifically with cognition and memory. This goes along with the fact that memory is often the earliest and most serious change for someone with Alzheimer's disease developing. The final 3 questions of the AD8 cover other memory functions, but also bring in another cognitive area that can be affected early, and that is financial management. The final score is the number of times the answer, yes, a change, was chosen. When the score is 2 or more, the individual is at increased risk for one of the dementias. With a sensitivity of 84% and a specificity of 80%, this is not a diagnostic tool, but does aid you in the diagnostic process. It's another piece of the puzzle as we put together this concern about memory loss or other cognitive change in a patient. In addition, it provides an important window into several important functional and cognitive areas for family members to begin to understand the changes that they're observing. In some cases, family members come away with additional understanding of the types of problems an individual with cognitive impairment may face on a day-to-day basis. Returning to our patient, while she felt her memory was, quote, no worse than all of my friends, quote, her daughter identified 4 areas of change on the AD8. This adds to our history and identifies the need to move on to cognitive testing or referral.